Welcome to the Elevate Female Leadership Podcast, where we talk about all things related to women in leadership. Today, I'm joined by Taylor Spinella, the clinical coordinator at Marvin. Hey, Taylor, how are you?
I'm great, Christina. How are you doing?
Good, good. Thanks for coming in and chatting today.
Of course.
Coming into our,
Yeah.
our Zoom world. I love it. So tell us a little bit about your role at Marvin and what Marvin's mission is and what your position there kind of has you doing on the day to day.
Sure. So Marvin is a startup teletherapy company based out of California, and we provide therapy services for healthcare workers specifically. So we contract with different hospitals or residency programs, some community health services, and have contracted therapists who provide outpatient therapy specifically focused on the challenges that healthcare workers are facing. And it's a unique niche, I guess, because there are so many unique challenges that healthcare workers face that the general population doesn't necessarily see. And so the idea is to end the one size fits all approach to mental health when it comes to healthcare workers and their being well. So because it's a startup, I wear a lot of different hats. You kind of pull your weight where you have to. But mostly I work with our clinical director in managing about 200 contracted therapists all across the United States. We're in a number of different states. Yeah, it's a lot of folks. So we're in over a dozen states with quite a few contracted hospitals and other systems that we work with. And so I work with our clinical director anywhere from recruiting and onboarding all the way through to when therapists are seeing clients, doing chart audits, consultations, performance metrics, and kind of data analysis for the behind the scenes clinical piece.
This is so close to my heart because, one of my primary missions in life is to try to reduce burnout in the healthcare realm. And that is part of what you're doing. I know Marvin is addressing so much more than just burnout in healthcare. And burnout's got to be a huge piece of that.
Yeah, absolutely. I mean, it's something that we obviously provide a lot of specialized therapy for folks who sign up. One of our screening tools, we use the Maslow burnout inventory as soon as people sign up, because a lot of folks don't even know that they're burnt out. I know
You're speaking my language.
So, we administer that right when they sign up, because what we're finding is a lot of folks don't even know that they're burnt out. And the different facets of that, it's not just this overall feeling of being burnt out, but the emotional exhaustion, the personal achievement, the, depersonalization when working with patients and clients, and, just being able to put a name on that and say, hey, did you know that you scored kind of high in this? And kind of exploring how that touches and interacts with other facets of their mental health has been really, really helpful for a lot of the folks that we have.
How did you end up in this role?
It's kind of a long story, but to sum it up, I was working in a community mental health clinic in Pennsylvania, and I had worked for the agency for about 4.5 years. I had started there as an unlicensed master's level clinician, went through, did my supervision, got my license, and then had practiced just under my license for a while there, and was actually given the opportunity to start a brand new clinic in a brand new county. And it was something that I was always just really interested in. The area is very close to me, and I know the challenges there. It's, the county where we worked was at one point very affluent because it's coal country. And so there used to be a lot happening in that area. And just with how we've moved away from coal and other fossil fuels, the resources left when that left too. And so there's this kind of really unique gap that was happening in the community. And so we opened a clinic, and it was actually the first state licensed co-occurring clinic in the entire county, which was really surprising for us because there's unfortunately really rampant alcohol and other substance use problems. And I don't think that there was, more than maybe 20 people by the end of the first year who had not used some kind of substance in their lifetime or was not struggling with it by the time, we got through that first year. And
Out of all the people you were
out of
serving,
all of the folks, so we had over
there's
200
20.
folks. Yeah, we had over 200 people who were active clients, were actively engaged in services at least once a week after the end of 12 months. So it was obviously a much needed service in the area.
Mhm.
To expand that fast was just kind of, it was extraordinary. We didn't expect it. I think our goal was 100 at the end of 12
So
months.
you were running this entire
Mhm.
program, and I might be skipping ahead a little bit, so stop me if you need. How many therapists, if you had 200 clients, how many therapists were working in this new program?
Sure. So when we first started, it was myself and one other clinician who was very green. So he had just gotten his degree. And so he was still doing licensure supervision. And so I was the only licensed clinician in the clinic. So it was just the two of us. I think by the time I ended up leaving, we had four clinicians, but still that's four clinicians for 200 people. So it's
You could
quite a
see my
lot.
reasoning for asking.
Yeah.
Yeah, that's exactly what I wanted to get at.
It,
Wow.
I was put in this strange position that I was a clinic director. So I was responsible for administrative oversight and, a lot of public relations with the community as far as working with probation and parole, CYS, county funding, all of these things. And I actually still had a caseload of over 40 people myself. So I had 40 clients and managing this brand new clinic, still trying to make a name for ourselves, still trying to provide, obviously, much needed services in an area that had no resources. It was a lot.
Taylor, the numbers are not adding up for me.
No.
So you were seeing 40 people, and I'm assuming you couldn't have been seeing them all weekly.
I would say that probably three-quarters of the caseload I saw at least once a week. So at least 30 folks that I saw once a week. There were probably 10 that were high functioning enough that I saw them like every 2 weeks or every 3 weeks. And I even had a few that, there weren't a lot of appropriate levels of care in the area just because of lack of resources. And so there were folks who really were on the border of needing maybe an IOP for mental health, but we just didn't have it. And so I was seeing some folks, I want to say there were probably 4 or 5 folks that I saw twice a week. So it really did end up being about 40 sessions a
Taylor,
week.
okay, so you had 40 clinical hours a
Mhm.
week. And then how did you get the other work done? I mean, how many hours were you working?
I think in a good week, I would work, like if I didn't have extra supervision or I didn't have to provide to a therapist or I didn't have staff meeting, I was working at least 50 hours a week. I think on average, I probably worked closer to 60. And that was, it was a slow build up in the beginning, but by 3 months in, we had 50 active clients, and that was between two people. So, and my coworker, because he was so new, he didn't have nearly as large of a caseload because he needed to get his feet settled. And this was his first clinical job. So it wasn't something that, we didn't want to throw 40 clients at him right away.
You were
And
holding
so,
space for him.
yeah,
You
absolutely.
were
He needed it.
protecting.
Yeah.
I'm sure you didn't want to lose this person, but you also didn't want to like traumatize him, I'm sure.
Well, yeah. I mean, I think people understand when they come into clinical work that you kind of have to pay your dues when you first start, right? We start as TSSs and being bit by children and, all of these jobs that are not necessarily the fun jobs. You don't go right into private practice. So we know that we have to do the hard work, but that doesn't mean that you need to start your first job with 40 clients. That's not something it's not reasonable. It's not feasible. It's not anything that I think a new therapist would really be able to handle appropriately. And not just for the therapist, but for the clients too. Client care is compromised at some point when people start to get overwhelmed. And, you know, I don't want folks who are in the community coming to us feeling like they're being neglected or feeling like they're not getting the care they deserve because we're overrun.
So, how did you manage this really intense workload?
Unfortunately, not very well.
I don't think
I would
anybody
say.
could.
Yeah, in the beginning, I thought it was something that I felt like I was really doing meaningful work. And I still felt like that. But there was a lot of things that started happening where there were so many competing priorities, and I just couldn't keep all of the balls in the air at the same time. And so unfortunately, I was trying to do too much. And my personality is I can never do too much. Like I always just have to kind of keep going and going and going. And unfortunately, that led to a lot of burnout for myself. It was something that I didn't recognize was happening until I was really, really far into it.
Mhm. So how did you like when did it strike? When did it hit that you were just fried?
Yeah, there were a few things that when I look back now, I'm like, how did I not notice that this was happening? But I think it was kind of this slow accumulation. I started not to feel joy when I went to work. It was more stress than joy, or more worrying about how I was going to get everything done, and less about, I really helped this person today, right? Like that thought didn't start to come to my mind as often as it usually did. And looking back on what I know now, right, this is the start of lack of personal achievement in work, which is one of the main factors that we look out for burnout.
Mhm.
And there was a lot of that happening. I mean, it got to the point where I was crying on the way into work almost every day, just dreading having to do what I was going to have to do. And that was never a place I wanted to be. Obviously, I don't think no one wants to be in that situation with work. And it was also like I didn't hate when my clients didn't show up. I was actually kind of
Mhm.
happy when people would cancel on me. You wait for that ding for the client to check in, and it doesn't go off, and it's 12:15. It's 15 minutes after their session. You just like, right, like that visceral, like I can stop holding my breath. That was, that was really kind of the point where I was at.
What was your personal life like when you were doing this 50, 60 hour a week dance? And like just for context for non-clinical or non-mental health professionals, 40 client facing hours is an intense level of work that no person is supposed to be doing. Like that's not, no therapist functions long term
Right.
or, or even short
Yeah.
term.
Yeah. I
Yeah.
think,
So,
it was one of those things that I also didn't recognize that how much it was carrying over into my personal life. So it was difficult even from the beginning. I had a contract that required me to do 2 evenings a week. And so evenings were classified as ending your night at 8, like ending your workday at 8 o'clock at night. So I went in later on those days. And so I didn't get to the office until about 10:30 in the morning, which is like later for me. So I get there about 10:30. I would end up leaving probably around 8:30. So I had to finish documentation, and, I would close up the clinic and do all of these things, make sure everything was ready for the next day. So that was 2 nights a week. And then the rest of the days were just, I'd get there at like 7:30, I'd end at 4:30 and then go home. But it was really stressful for myself. And I've lived with my fiance this whole time. And, we were really disconnected. I didn't want to hear what he had to say at the end of the day. And that hurts me so much to say, but I just couldn't listen to another person. I was so emotionally and empathetically exhausted. And, it was the little things, like everything bothered me. The dishes in the sink bothered me. My dogs crying to go to the bathroom was like the last straw on some days, right? And they're just being my sweet, beautiful little pups, right? Trying to tell me that they need something, and I just couldn't do it. I was just, everything just sent me over the edge. I was angry all the time. I was sad, and I felt guilty that I was angry and I was sad with them. And I felt really disconnected. And I started to notice that all of those things were happening at work and at home. And that was really, one of the points where it's like, this has to change, because I'm going to lose people if I continue to act this way.
you mean in your personal life?
Yeah. In both.
So,
I mean, in the personal life, I think hit harder, right? Because obviously they're your loved ones, but
right.
it wasn't fair. It wasn't fair to me or them. And, something really had to change.
Was it like an all at once moment of something has to change, I'm going to do something different? Or was it more of a trickle or of a eventual coming around to this?
So it was kind of an all at once. moment. So I had a staff meeting to run one day when I went in, and I was just a disaster that day emotionally. And I had cried the entire way into work. And the staff meeting was the first thing on the agenda for that day. And so I rolled in and I was talking to my direct supervisor, the director, regional director. And we were going through things. And I remember he just asked me how I was doing, and I just couldn't hold back. And I just started sobbing in my office talking to him. And, I was telling him, like, I'm so upside down. Like, I'm so burnt out. And I used the word burnout because at that point I realized, like, this is not normal. Right. And I had been mulling that around in my head and had decided, like, I think that this is what this is. I'm not 1,000% sure, but I'm like 99.9% sure that this is what this is. And I told him I'm so burnt out. I need help. I need therapists. I need resources. I need all of these things. And, he listened to me say all of that. And then I was met with, okay, well, I think we're just going to end our meeting early so that you can collect yourself for staff meeting. And I just, at that moment, that was the switch, because it was, how am I feel like such a hypocrite feeling all of these things and then going out into a staff meeting where people are also feeling these things and they're looking to me for help and resources, just like I'm looking to my upper leadership for help and resources. And I'm saying, like, okay, well, just kind of march on through your day.
Let's take some deep breaths and then get
Yeah.
back to it.
Yeah. Basically. And, from that moment, it was like, I really need to figure out how to change something. And it unfortunately wasn't the first time I had verbalized needing resources and needing help. I wasn't at this burnout point yet when I had originally started talking to my upper management about this. But, they say burnout is because of a lack of boundaries. And I like to think I have fabulous boundaries. I am the clinician that's on top of boundaries and communication. And I'm always pushing that with my clients. You have to put yourself first. You have to communicate your needs. You have to do all of these things. And then people would tell me, like, well, what do I do if they don't listen? I say, well, either you need to keep pushing or something needs to change. But I never internalized that for myself. And so, I would ask for all of this help, and either it would fall on deaf ears or they would say, like, we hear you, we understand you, but we can't do anything. And it kind of just was this perpetual answer. And that answer wasn't good enough for me anymore because I couldn't keep doing this. So at that moment, I put I put to myself, like, this is my responsibility. I've done everything that I can here to try to protect myself and my clinic and my clients and my therapists. And it's just not working. So I had to take a step back.
So what did you do?
So the first step was that I went to therapy.
Right on.
I've had other things. Obviously, we all have things in our lives that we should have gone to therapy for a long time ago. But, having the guilt that I felt and the inadequacy I felt from being burned out was so forward in everything that I was doing. It was a large agency that I worked for. There were dozens of locations, and I had known the other clinic directors from leadership meetings, and I would compare myself to them, right? And they're always so happy and they have these great stories about their clinics and they love their clients. And there were clinics that were 5 times the size of mine. And these clinic directors were doing just fine. So was there something wrong with me? Was I not a good enough clinician? Was I not a good enough clinical director that, that I was doing something wrong? Because everyone else was flourishing, or at least it looked like that. And so part of it was, going to therapy and having a space where I could explore that and not feel judged, right? The therapist I work with, she was just absolutely amazing at doing that. And, helping me recognize that there were things that were outside of my control, very obviously, and kind of guiding me in my own, in my own insight to, I've done everything that I can. And is it time to find a new job? Like, is anything else going to change in my position? And if not, maybe it's time for me to look somewhere else. And so that's kind of where it went. So I started looking at other positions in other agencies. I looked at client facing, non-client facing, and I there was this pull that like I had to do client facing work because that was my degree.
Mhm.
I'm a therapist. I had, a clinical counseling degree in undergrad, and I had a clinical mental health counseling degree. And for my master's degree, I had my license. I had put all of this time and this money into being a therapist. So would it be a waste for me to not see clients anymore? And so that was its own struggle, trying to decide if I wanted to keep doing the client facing work, which was no longer fulfilling for me, just for saving face of my degree.
At that
But
point, I don't know how it could be,
yeah,
you
and
know?
it's
Yeah.
it's just it can't be, you know, if I maybe had been a little more proactive in recognizing like when I was getting burnt out, then maybe I could have gone back. But I was to the point where I tell people like I was crispy, like I was beyond burnt out, right? I am charred black gunk at the bottom of the oven. Like this is beyond burnout. And
Yeah.
I didn't want to get to a point where I was causing harm to somebody else because I wasn't able to be there for them. And so I made the
Yeah.
decision that I needed to look at not non-clinical, non-client facing work and try to figure out how to leverage my degree and my clinical experience and my director experience, but in a way that was going to be really fulfilling.
So how did you come across this position at Marvin?
So I actually was reached out to by the recruiter at Marvin initially to be a therapist at Marvin.
Mm,
And it was a very tempting offer coming from the world of community mental health.
especially with all these beliefs that you just shared.
Yeah, absolutely. Right. And it's there was no like productivity limit. Like I didn't have to reach this certain number. The pay was more than anything I had ever seen because it was commercial insurance and it was it's a private practice model. So there were so many things about that were so tempting. And I remember I got the message from the recruiter and I looked at my fiance and I said, "Do I sell my soul to the devil?" Not that Marvin was the devil, but do I go back after I just made this
Right.
decision?
Go back to clinical work
Do I go back to
after you
see
just did
clients?
all right, the client facing work, after
Yeah.
all of this exploration with your therapist on, do I change my professional identity? And struggling with that and coming out on the other side saying, I'm ready to change my professional identity, at least in
Yeah,
some
in some
facet.
capacity. Yeah, and then to be met with the best client-facing offer I have ever seen, right? That ever has been given to me. And, I had to think about it for a while. There was a few days where that was the only thing I thought about. Like, what would my life be like if I did go back to seeing clients? Am I going to be in a place where I can do good work? Are my clients even going to stay with me? And so I finally did get to the point where I realized that I just wasn't ready to do client facing work. And while it was the hardest message back I think I have ever sent in my life, I said that I told the recruiter, I said, like I'm just really not in the position to take on a client facing position. But do you have maybe non client facing positions in the clinical realm at Marvin? And I was met with, absolutely, we have this wonderful opportunity for a clinical coordinator. And then kind of the rest was history. But
Did you just send that and hold your breath?
I did. It was, I had gotten to this point where I realized that the next job that I went to didn't have to be my forever. I just needed to get somewhere where I was going to be able to have the time and the resources to focus on myself and to be better and to get well. And so if this wasn't the job that I wanted, or if it wasn't the job that was going to suit me, that's okay. I'm allowed to take a step back and say, like, this is going to be temporary, even if it just is
Mhm.
enough to give me the space to heal.
Yeah. So then you made this transition over to Marvin, and was that a long, like, once you knew you were going to be going over to Marvin,
Mhm.
how was the rest of your time at the other agency where you were just beyond burnt?
So I gave 2 months notice.
Wow,
Or
that's incredible.
yeah, I knew, not necessarily for like the upper management, right? They only really need a month. But I had 40 clients to terminate with. I had so many community relationships to terminate with, and I had therapists that I had to transition to a new, lead clinician and all of these other things. And I didn't want to cheat any of them also out of the opportunity to, have closure. I'm leaving, right? And so they need to feel secure in what's happening. So there was 2 months of me kind of, once I made that decision and once I had a start date with Marvin, I let everyone know that this was going to be my last day, gave people time to process, had final meetings with community leadership and things like that, just kind of talking about transition plans. And there was kind of this like weight lifted when I gave my 2 months, when I gave my notice, because there was, the super cliche light at the end of the tunnel, right? Like this time and this thing that was pushing me into just this awful space for me, it was finally going to come to an end. And I hate to think of it that way. And I think if, there are things I would have done differently so that I didn't feel like that was how it had to end. But, that it was unfortunately just where I was at. I needed to leave. And also too, I mean, it was different because people, obviously some clients are like, okay, well, I only need a couple more sessions and then I'll transfer to a new person. And so then my caseload got less. I had less meetings and I was like, oh, I could do this now because now I only have a caseload of 20 folks and, significantly less community interaction. So it almost felt like this, like, did I mess up?
Oh, wow. That must have been scary.
It was super scary. But, it's also one of those places I made sure that, I'm a person that I don't like to leave things on a bad note. And I was told by all upper management, really, like, if it doesn't work out, please come back. We'd be happy to have you back. And so there was that safety net of, "Well, if this didn't work out, I could go back." But I didn't really think it wasn't going to work out. There was just something in my mind, I guess, out in the universe that knew that it was going to be a good change.
So you transitioned over to Marvin, and my understanding is that you just found this absolute sweet spot of a position that's
Yeah,
like basically made for you.
yes, it was. Yeah, I remember having my first week and telling my mom like all about my coworkers and my leadership and the position, and she's like, "You sure this is real?" I was like, "I don't know. It's too good
So
to be
tell us
true."
about
Right.
it.
So
Tell us about the perfect match.
yeah, so when I was seeing clients, obviously we're all very eclectic and we meet clients where they're at, but I identify mostly as an ACT clinician, right? So acceptance and commitment therapy. And so values are something that's like super, super important to me. Values alignment, committed action to changing what you can. Like those are the things that I had always given my clients, but I had not given myself. And so the values at Marvin were perfectly in line with everything that I found or everything that I valued in an agency. Just respect and autonomy and learning and all of these wonderful things. And I was just like, oh, and wellness was is one of the core values too. And so there was this expectation actually of putting yourself first and of being well. And if you needed the day, you needed the day, and that's fine, but don't sign on. And so there was this amazing values fit that just felt really natural from the start. And it was also kind of the best of both worlds. So I still get to use all of my clinical training. I'm working with therapists on a daily basis. I do case consultations. I do differential diagnoses with therapists. I still talk to clients every once in a while when they're upset or if there's an emergency and a therapist isn't around. So like I still get to use that piece that I learned and I was so attached to. But I also I have a love for numbers and statistics. And I know that's not something that a lot of people who are clinical folks enjoy.
It's not.
so, so one of the wonderful things at Marvin is, our upper management, they want you to do things that you are passionate about. And they want you to take on projects and they want you to have the initiative to explore things if they're meaningful to you. And so, I had told our CEO during one of our meetings that I really love statistics and figuring out the puzzle and taking my clinical background and figuring out what that means. transforming the numbers into a story, right? A clinical story that actually tells us something. And he jumped on it right away. He's like, if you want to do that, I have all of these projects. I have all of these metrics that I've always wanted to do. And I just haven't had the time because he's the CEO, he's busy, right? And so that kind of became more my role. I still do all of the things with our clinical director in terms of like therapist management and all of that. But a large part of my day now is spent doing metrics and analysis and things like that. And it really just makes me happy because I love doing that kind of stuff.
That that is something that I think in many roles you would not find. You would not
Yeah.
have the opportunity to really dive into statistics like you've found in this position.
Yeah. I mean, it was really just kind of a dream. I still sometimes am wondering like, how did I do this? But
What a
it's always great.
wonderful transition
Yeah.
from just like completely overrun with too much.
Mhm.
It was just too much. Nobody can do 40 hours and run a facility, supervise people, create community relationships. That is not a burnout due to poor boundaries, or at least that's not
Yeah.
what I'm hearing. I'm hearing about the role being unreasonable,
Yeah.
unreasonable. And to go from that to where you are now, of taking that and actually, you really paused to learn and to develop insight
Mhm.
into how to make your life different, how to change it in the way that you want, not just go from one position that's not a good fit into another position that's not a good fit. And to have done that, to have taken that pause, seen, sought out therapy, and then really do this deep work. And I'm sure a lot of other work outside of the
Mhm.
therapy relationship and this self exploration. To me, this seems like it made all the difference in the world because you could go
Absolutely.
out and find another job. You're a
Absolutely.
licensed clinician.
Yeah. And even without, and this, I joked before, like even I joked with my fiance at one point. I said, like, well, the gas station up the street is hiring for a managerial position. And so like you make a joke, right? But at some point there's this piece that's like, well, I really
Mhm.
could. And it doesn't pay all that much less than community mental health, right? And it's a joke, of course, but it wasn't going to be fulfilling. And even if I went to another clinician role, right, where I was doing direct work and client care, there was nothing to say that changing the agency was going to fix everything.
Mhm.
And, I didn't want to be in the position that I was in again 2, 3, 4, 5 years from now at another agency and having all of these things happen at the same time. It just didn't make sense to go from
Yeah.
one to another.
Yeah. I really appreciate you sharing so openly about this story of incredible burnout and the work that you had to do to climb your way out of that fire pit. And not the fire pit of the place where you worked, but just the
Right.
fire pit of burnout,
Yeah.
of that mental place.
Mhm.
Because we think for so many of us, I've seen it and I have been there myself too, that because we've got all of this knowledge, we've got a license, we help other people, that we're not going to be impacted by unreasonable expectations, by being stretched just way too thin, kind of puts it mildly, but
Yeah.
we're not going to be, we can handle it.
Yeah, and not even that we can, but that we should, right? Like there's this
Hey,
expectation that it is our responsibility to handle these things because we're the healers, right? Like we are the people who are supposed to be able to handle above all else mental health. And
mhm,
it's really just we're people. It's not reasonable. But
100%.
we put that responsibility on ourselves. And I think I'm so thankful that you wanted to do this interview and allowed me to share my story because I think that's a huge part of it is this isolation that we feel when we get into this place that I'm doing something wrong, I'm bad, I'm whatever it is. But a large part of my exploration process was talking to my fellow therapist friends and some who were not working at the agency anymore and some who were and just realizing how burnt out they were, right? And that it wasn't just me. There was nothing wrong with me. And I wasn't a bad therapist because of it. I just needed a change. And there was nothing wrong with respecting that need for myself.
Yeah, that quote needs to go up on a wall somewhere. There's nothing wrong with you.
Yeah.
You just needed to change and needed to respect that.
Yeah.
Thank you so much for sharing this invaluable lesson. I
No.
know there's, at the very least, thousands of therapists out there living what you lived through, and that would benefit and will benefit from hearing the story of how to really go in, dig deep, and make a change that's going to really make the difference in your life, not just out of desperation.